Here's ABC-7 News anchor Davina Fortson with the Chief Medical Officer for the East Bay Center for Elders and Dependents, Dr. James Mittelberger.
We all, at this point in our lives, likely know someone that's been impacted. Can you talk about those risk factors?
Yes, well, it's an exciting time for Alzheimer's disease, the fight against Alzheimer's disease. What we're learning is that the risk factors are very important. While it's a little bit random, really taking care of yourself, diet, even sleep in middle age, exercise, and staying engaged all have important impacts on reducing the risk of Alzheimer's disease. And the exciting thing is these are the same kinds of health behaviors that are important to protect your heart and other parts of your body.
So explain a little bit about what you do at the Center of Elders and Dependents in the East Bay.
Well, the other piece of Alzheimer's disease and health is that by staying engaged, we keep people healthy. It's really important that people have a place to go, to be with friends, to be with people that care about them, to be engaged in the world. This prevents Alzheimer's disease and also prevents some of the other effects of aging. And at the Center for Elders and Dependents, we really focus on people living their lives. We bring people into the centers and we take comprehensive care of them, their social and their medical needs.
Oh, I love that. I love that you all are there for them because I know they need it. There's a lot of research. There's a lot of promising research, but it still feels like there's a long way to go. How are you all feeling at the center about where we go from here?
The research, low tech plus high tech, we will get there. Right now at the Center for Elders and Dependents, we bring in the low tech, the people, the engagement, the exercise, the diet, help people live a good life. At the same time, there are scientists building tools and medicines that can slow the progression of Alzheimer's disease. That together, we are already seeing a reduced incidence of Alzheimer's disease, and I am really hopeful that if we keep pushing, we're going to make this a smaller and smaller problem. In the meantime, we're also helping people that have some Alzheimer's disease enjoy their lives. It need not be misery. We have lots of patients who have a little bit of memory loss, but are still living good lives.
Oh, that's so important. Thank you. I'm glad you mentioned that. As we close here, I am wondering if you have any sort of message, especially for people that either have a loved one impacted by memory loss or Alzheimer's, or even if they're impacted themselves.
Yeah, it is a big job to take care of somebody with Alzheimer's disease or to realize you're having it. Don't give up. Get help. It is very, very possible to live many years that are good with Alzheimer's disease. Don't despair. Start being really healthy and get help from places like the Center for Elders and Dependents, the Alzheimer's Association. Together, we can make a major impact on both slowing the disease, preventing the disease, and making life with the disease actually good.
I love your attitude around this subject. Thank you so much for joining us.